So we'll talk about tissue stability around implants. And I found out while I was doing this lecture that this is a really hard topic, because this is all we want. As German just mentioned, we want success around implants, and that means tissue stability. So everything we do, from teeth removal or from indicating removal of a tooth, like Stephen mentioned, until we have the final success criteria, like German mentioned, there's a lot of stuff we do in between that may influence this tissue stability around implants. So what I'll try to do here is to list the factors that may influence tissue stability around dental implants, recognize clinical situations where there is a greater risk for reduced tissue stability, and then recommend procedures that may improve tissue stability after implant-supported restorations. So if that patient walks into your office tomorrow morning or Monday morning, and then you just take an X-ray, what are we going to do on this case? You go to any meetings nowadays, and then you have a plethora of options in order to get a final implant-supported restoration that meets the criteria that German just mentioned, for instance. Now, are you going to do an immediate or an early implant placement? Are you going to graft it at the immediate placement, or at an early moment, or at a later moment? And if you are going to graft it, are you going to use what kind of graft material? Autogenous bone? Or maybe you go for a ridge preservation technique, or maybe use a bone substitute. And what kind of bone substitute are you going to use? Does it make a difference? How does that respond biologically to your procedure, your choice of materials? And then, are you going to use a membrane or not? And what kind of membrane are you using?